Hi, Catherine. How are you doing today?
Horrible. I don't feel good and I just don't want to be here. I've been waiting on my test results for so long.
I am so sorry to hear that you're feeling this way. However, I'm here with your test results. They came back positive for gonorrhea.
What does that mean? Is that why I'm having pelvic pain?
Gonorrhea is a sexually transmitted disease, and that's one of the symptoms along with many others.
How could I have gotten gonorrhea? I have never even heard of that.
Well, are you sexually active?
Yeah, all the time. But I usually know who the people are, and they didn't tell me they had this.
Sometimes STIs do not come with any symptoms, so there's a chance that whoever you got it from may not have known they had it. I hear you telling me that you have had sex with multiple people, but you usually know them. Can you tell me more about your sexual habits?
Well, this month I've been intimate with 10 people, I think. I knew most of them, though, so it's not a big deal.
Have you ever thought about the possibility of becoming pregnant?
Of course not. That will never happen to me.
Do you use any form of protection?
Why would I need to do that? I'm just fine. Plus, none of my friends use condoms anyway, and none of them got pregnant.
Condoms are not the only form of protection for pregnancy. Although they do protect against STIs, there are also oral contraceptives and other forms of birth control that are proven effective. Are you on birth control?
No, I don't need the pill because I always use the pull-out method. How could I get a disease or pregnant if he always pulls out?
So what I'm hearing is the only way you protect yourself from the dangers of sexual activity is by having your partner remove himself before ejaculating?
Yes, that's right. So I don't know how this happened to me. I've been having sex since I was 14.
Unfortunately, that's not an effective form of protection against pregnancy, especially against STIs. STIs are spread through any sexual contact. It could happen at any time. It spreads through skin-to-skin contact and can also be spread through fluids such as blood, vaginal fluid, and semen. It can even be spread through oral sex.
This is so embarrassing. I've heard you have to tell people if you have an STI. I am not doing that, though. If anyone knows this, they won't talk to me anymore. I won't even be able to have sex with anyone ever again.
I'm sure you are frustrated with this. I hear you saying you don't want to tell your partners because you want to have sex and you feel ashamed about your STI.
No way. I'm not telling them. I can live with the pelvic pain, but I cannot live with the embarrassment and not being able to have sex. This has been my life since I was 14. Can't the doctor just give me a medication so I can leave?
The doctor has written you a prescription, but in addition, it may benefit you to change your sexual habits in order to prevent this from happening again. This includes the condoms and birth control we spoke about. I can give you a pamphlet so you can learn more about this at home. Do you have any questions for me before you leave?
No, I don't care. This won't happen to me again, so I will take the prescription and go. You can keep your pamphlet because I don't want it.
The patient today was in the pre-contemplation stage, unaware of the risks involved in her sexual behavior. The patient seemed hesitant to open up and did not seem to find a real need for change. She does not perceive her habits as an issue and does not want to change because she feels like her habits are not harmful to her. The interviewer has used open-ended questions, so for example, she said, "Can you tell me about your sexual habits?" which makes the patient think more about her responses. The interviewer also used reflective statements to help the patient realize her behaviors, where the interviewer displayed active listening and tried to give the patient information on STIs in hopes that she would come to the conclusion that on her own that a change in her sexual habits was necessary. Clarifying language was additionally used to understand the situation better for the interviewer. A pamphlet was given at the end of the session, but ultimately the patient was not compliant and did not feel like there was a need to change her behaviors. The interviewer's goals was to have the client come back in when she was ready to talk about her sexual habits and how to be safer when participating in them. The pamphlet was given to have the patient continue reflection at home based on the conversation they had in the office today. The patient does not desire change, nor does she have any commitment to the change.
Hi, Catherine. How are you doing today?
I'm really scared. I think I did something bad.
I can see that you're really upset. Could you tell me more about what you're scared about?
I came in a few weeks ago and the doctor told me I had gonorrhea. I didn't really care then. I even kind of forgot to take my medication. But now I really like a guy and I gave him this. And I'm the only sexual partner he's been with, so it had to have been for me. Now he won't even talk to me.
So are you saying that your incentive for wanting to change your habits is that you want to be with this guy?
Yes, and I'm so upset that he won't talk to me. I can't believe I'm even saying this, but I need to change my ways. I should have taken that medication that was prescribed to me.
I'm hearing that you have not been taking your medication. Can you tell me more about why that is?
I started to feel better, so I didn't think I needed it. I thought the disease was gone, so I stopped taking it after a few pills.
It is important that you finish your entire prescription in order for the disease to go away.
I can't let this happen to me again.
What can you do to ensure that this won't happen to you again?
Maybe I will focus on one guy instead of having multiple partners, like I have in the past. I know I've been promiscuous, and that's what got me here. It's my own fault, and I need to make a change.
That sounds like a good idea. Having less partners will definitely decrease your risk of getting an STI. Have you thought of any other ways to prevent this sort of thing from happening to you again?
I remember in my last visit we talked about protection such as condoms instead of the pull-out method that I was using. Do you think that could help?
Absolutely. Condoms, as well as other forms of protection, can prevent STIs and pregnancy. Condoms work by covering the infected area to avoid spreading infection. Not only do they prevent the spread, but they can also prevent them in the first place by preventing the skin-to-skin contact. Using these are crucial in good protection.
That makes more sense. I guess I can see how they're helpful now.
So Catherine, after talking for a while, on a scale of 1 to 10, how confident are you that you can implement these changes? 0 being not confident at all, and 10 being the most confident you could be.
I guess I would say I'm an 8.
I noticed that you're very confident. What is your timeline like to make these kinds of changes?
I'm hoping to start my changes today, and I can maintain them as long as possible. I hope I can be with one guy from now on, because I like him so much.
It is clear that you are really going to make an effort at making a change. This is a big step in the change process. You should feel really proud of yourself for coming up with this plan of action. Before you leave, could you tell me the 3 most important things that you're going to take away from our talk today?
The most important thing would be protection like condoms. These things will block the spread of infection. The next would be, I guess, having less sexual partners, because the more partners I have, the more likely it'll spread. Lastly, if I ever get an STI again, I'm going to make sure I finish the medication and get checked before I am sexually active again.
That sounds great. If you need any more help or have any more questions, feel free to come back to the clinic. Here are some pamphlets to remind you of what we discussed today. You coming in today showed a true commitment to change.
Thank you.
The patient is in the contemplation stage. She came back to learn more and is looking for assistance in making the change. More open-ended questions were able to be used, and the patient was more compliant and willing to talk about this topic than before. The interviewer said, "How can you implement this goal? And have you thought of any other ways to prevent this sort of thing from happening to you again?" The teach-back method was also used to assess how well the client understood the information being given. The interviewer said, "Before you leave, could you tell me the 3 most important things you're going to take away from our talk today?" The patient seemed confident in telling the interviewer what she learned. She rated her confidence as an 8 on a scale of 1 to 10, based on ability to change based on discussion. The patient sets a goal to be with one person rather than multiple people, and decides to use protection. The patient works together with the nurse to teach what was previously taught in the first appointment. She is more willing to learn, and the patient is starting to realize that she may need to change. The nurse's goal for the patient is that she will understand the information taught and will not come back in the future with STDs. There was also a use of affirmations, like when the interviewer said, "You should feel proud of yourself," and "You coming in today shows a true commitment to change."